As the coronavirus pandemic continues, an increasing number of Americans are not happy about the way President Trump is responding. According to a CBS News poll released this morning, 52% of people think the president is doing a bad job handling the outbreak. That means, for the first time, more people disapprove of the president's strategy than approve of it. Ben Tracy is joining us now from the White House. Ben, we've seen increasingly the president has come under attack, criticism by generally safe news organizations. For example, the Wall Street Journal editorial board saying that his briefings are running long and they are more of a campaign rally than actually providing information to the American people. And the president has continued to indicate that he wants the country to open up sooner rather than later. During the briefing yesterday, he was asked about opening up the country when there isn't enough testing, there isn't adequate testing. The reporter asked the question, should you not have testing in place before you open up the country? The president said no. So now we've seen this poll. What are you hearing from the White House as far as the response to the polling and to the criticism?
Well, the White House has not responded to this poll in particular. The president does think that these briefings are effective for him. He views it as a way to reach his base. But in terms of the data in the poll, let's start with the one bit of good news in there for the president, and that is that a slim majority of Americans overall, about 51%, believe he's doing a good job handling the economic impact of this. But when it comes to people who don't think he's doing a good job, they think he's doing a particularly bad job, especially when it comes to a few things. So let's go through those. A vast majority of Americans who think he's handling this poorly think he's not getting states and doctors the resources that they need. 78% of these people say overall they don't trust the president's judgment, and 72% say coronavirus is not being contained. Now, keep in mind, those are numbers based on people who overall think the president is doing a bad job. Those who think he's doing a good job, we should note the numbers are not particularly high, but they are over 50%.
People do not trust the president. Who do they trust?
Well, this might not be surprising, but people do trust medical experts. They want to hear from people who have subject matter expertise when it comes to these things, because we are talking about life and death. So the medical experts get the highest marks. The Center for Disease Control is viewed as a trusted source, and this might not be surprising either. President Trump is not considered a trusted source when it comes to medical information. In fact, the number that the president gets is 37% of Americans say they trust him for medical advice. That has not stopped the president from giving out medical advice on television. At these briefings, he's often touted certain drugs, especially hydroxychloroquine. He's talked about dosing information for drugs. And at times, it's just been striking to hear the president of the United States behind a podium telling people what drugs they should take and in what quantities. But just 37% of Americans say they actually trust him for that kind of advice.
So, Ben, our polling team also spoke with people about the outbreak's economic impact. How are those fears affecting different age groups?
So younger people seem to be impacted by this more, and they seem more concerned. And that does make sense. They have fewer economic resources, financial resources. They're more likely to have lost their jobs. You think of all the bars and restaurants in cities all over the country that are closed down. Those are disproportionately staffed by younger people. So when you look at the numbers here, they're worried about paying their rent and their mortgages, their medical bills, just buying groceries. With older Americans, and this also makes sense, they're more concerned about their health. They're more concerned about getting coronavirus and what that might mean to them, because they're in that riskier age group and having serious issues and, possibly death for somebody who might have underlying conditions.
And so, now that we've seen maybe sort of a glimmer of hope, there have been some positive numbers, particularly here, in New York, which is the current epicenter. There is talk about reopening the country. What are officials saying about that process?
Well, that depends on who you ask. It is very clear that the president, his economic team, his political team, they very much want to get the country back up and running as soon as possible. And they're kind of focusing on early May 1st. The reason that date keeps coming up is because that's at the end of this 30-day stop the spread guidelines. So that's kind of the earliest it could happen. But then when you hear from the health experts, they say, whoa, 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 let's not get ahead of ourselves. We need a robust system of testing and monitoring in this country before we can safely do that. But the president was asked about that yesterday, and he really kind of poo-pooed that idea. He said, yeah, it'd be nice to have all that testing, to have widespread testing in the country, but we might not have it. So it's clear that he's laying the groundwork for perhaps allowing businesses to reopen before that is in place. The other thing we should keep in mind, though, is that this ultimately is not up to the president. This is up to governors in their states, mayors in their cities. They're the ones who shut things down. They're the ones who get to decide when things reopen.
And Ben, to that point, there's another factor as to whether or not the country is open by May 1st, and it's something that Dr. Anthony Fauci said this morning on CNN, which is that the virus ultimately is going to be the deciding factor as to whether or not the country or parts of the country open up, in addition to these governors. And when the President of the United States, in response to the point that you just made, was asked about nationwide testing and the President saying that it wasn't needed, he answered no when the question was asked to him. I wonder then if you would see governors pushing back. For example, I can't see here in New York City, which is the epicenter of the coronavirus pandemic in this country, Governor Andrew Cuomo saying, yeah, May 1st, we're ready to go, everybody back to work.
Yeah, it's really hard to imagine that happening. And you're right. I mean, the number of cases and deaths are going up every day. So we're not really at a place where it feels right that you'd be talking about reopening the country. I think if it came to that, if we had this kind of extraordinary situation where the health experts say it's not time, but the president says it is, you certainly would have some governors who would push back, especially in these states that are very hard hit right now. But you would have governors in states who very much want to get their states back open. You have the governor of Florida right now talking about reopening schools, and that is a state that has a real issue with coronavirus. So the president, while he doesn't have the ultimate say on it, he certainly has a very big megaphone and could put a lot of pressure on those governors, and a lot of people in those states who want their jobs back might put pressure on those governors to reopen if that's what the president says. As for now, the president is still saying he's going to defer to the health experts, but it is clear that he is increasingly impatient with how long the country's been shut down.
All right, Ben Tracy, thank you so much.